Structural means something that has to do with the structure. Okay, while functional means um, the normal activities of the brain will be impaired because there is something affecting it. But there are things that predispose people to having brain diseases or nervous system disease, and this generally is what we call risk factors.
Okay.
And what are these risk factors? They include some diseases that are also common in our environment. When somebody has something as common as diabetes mellitus, that person is already at risk of having a brain or nervous system disease. When somebody has hypertension, that person is also at risk of having some brain diseases. When someone takes alcohol, right?
Yeah.
For us as neurologists, we say alcohol is toxic to every part of the brain and the nervous system, all right? When people take substances, other substances of abuse, like that young man was speaking about, and in our environment, in our days, a lot of substances that people abuse, both young and old, and each of those substances can be toxic to the brain and to the other parts of the nervous system. When people have high level of cholesterol, what we call generally what we refer as to fat, but somebody could actually be fat physically and the cholesterol could be normal, and somebody
No.
could actually be normal weight
Mhm.
and the cholesterol could be high.
Now let's
Yes.
this particular one, cholesterol. How can you tell one has a high level of cholesterol?
Yes, there are tests, there are investigation, what we call lipid profile. So if the lipid level in the body is done, that test will tell you whether the cholesterol is high or normal. The lipid profile has different components. What we call the total cholesterol, the what we call high density lipoprotein, the low density lipoprotein, the triglycerides.
Yeah, these are highly
So
medical terms.
they are highly medical terms, but
When should
generally,
one actually
yes.
present for this? It's not a deviation actually.
Yeah.
When should one present to have this test carried? Should it be
Okay.
a general thing, or because we're looking at the brain
Yes.
and how certain things that predispose one to this, and this one actually caught my attention.
Yeah.
We know of alcohol, we see people do that, and we
Yeah.
actually see the reactions already.
Yeah.
But these ones that are hidden,
Yeah.
yes, how or when should
Yeah.
one,
Okay, fine. Yeah, cholesterol many times may not be obvious because, like I've said, it's not a function of the weight. Okay, even though commonly people who are obese may likely have high cholesterol, but when people present with neurological problem and a doctor, physician is evaluating on in the course of investigating, these are some of the tests ideally that should be done. And when they are abnormal, above the normal level, then something should be done about it. And this could be drugs. And sometimes when they are not too high, it could just be lifestyle modification. The kind of diet to take, what to avoid, what to take, that could handle it. Now going forward, we're looking at the things that predispose people to have
to brain diseases.
brain diseases. Apart from these ones I've mentioned, even sometimes people could be exposed to chemicals, and a lot of chemicals also are in our environment. Some pesticides, some herbicides. All this could predispose people to have neurological disease. For instance, people who develop much years later, who work in chemical industries, could develop what we call Parkinson's disease, say disease that the hand shakes and all that. The cholesterol I've just mentioned, people who have high cholesterol, who have diabetes, who have dementia, they could even also have a stroke, like we have mentioned, right? So all these are risk factors for, and even in our environment also it's important to know, particularly there's a lot of psychosocial stress. The economic stress is also taking a toll on a lot of people. That makes people work without resting. So even not sleeping, stress also can predispose to neurological or brain diseases. It can predispose to stroke and other brain diseases. And even inactivity, or what we call sedentary life. In our days also, a lot of people work from home. They sit in one place for hours without moving. That is sedentary life. Okay, that can predispose to obesity, and eventually that can also predispose to brain disease. So several of these risk factors can make people develop brain disease.
Okay, that's been beautiful talking with you, Dr. Iwozo.
Thank you
It
very
is still
much.
Talk Health on Benue Television. You can actually follow the conversation on all our social media handles at benuetv.ng. You can call us. The phone lines will be open soon. 0813 2009411. Again, the number to call will be 0813 2009411. Call us. Let's know what you think about the World Brain Day. Let's know how aware you are. Let's know what you're doing to keep your brain healthy. Ask the doctor your question and you get answers directly from here. We're moving forward. Let's take a look at this. How related is the brain health and mental health?
Right. Very important. Like I said earlier on, the brain has different parts, and these parts play different function. Okay. I need to take it from there. For instance, in the brain, we have the part we call the cerebral cortex. And the cortex has different section. We have the frontal cortex. When people have problem with the frontal cortex, because the frontal cortex is responsible for movement, right? For my hands to move, my leg to move appropriately, right? It means there must be integrity, or the frontal cortex is working well, right? The temporal lobe, which is part of the brain, has also other roles it plays. It controls behavior. It has role in memory, right? The parietal lobe plays role in sensory, making you to know you're on this is your left side, this is your right side, okay? The occipital lobe plays a role even in vision, knowing this object is here and all that. So for instance, looking at brain health and mental health, if someone has a problem with the brain, and this problem, for instance, affects the parts that controls memory or the parts that controls behavior, invariably the person's memory will be affected. And sometimes you see people who have issues with memory. For instance, those who have Alzheimer's disease, which is a form of dementia, is the commonest cause of dementia globally, including in Nigeria. And people with this have problem even understanding. Sometimes when you speak, they are not able to retain new information. The old ones they have may be preserved, but new information they're not able to retain. This person, sometimes you see them, they are agitated, they are restless, not able to sit in one place, they are uncoordinated, they could wander. Sometimes these are people who have known their children, their families, close relatives. They are not able to recognize familiar faces,
No,
familiar names.
Is that as a result of old age or
All right.
or some mental health challenge?
Yeah, it's a mental health problem, it's a brain problem. So actually, many times we can't separate brain disease from mental health disease because they are intertwined, right? Now, not necessarily age, because you could also get people at 80, get people at 90 who are not forgetful, who don't miss their ways, who still know their children, who still know close friends and relatives and associates, who won't see their first son and can't remember his name, who will go to the next neighbor's house and on returning back home, we miss his way and go to somewhere else, who built his house, knows the way to his bedroom, and when you want him to go to the bedroom, he rather goes outside the house because he doesn't know his way. It's a brain disorder. And this brain disorder also will present with some mental health abnormalities because this person is not able to recognize familiar names, familiar faces, is uncoordinated, sometimes even his language, he can't speak clearly. All right, so generally you can't separate brain disease from mental health disorder, even though in the realms of mental health there are a few other things that are common when we talk about mental health, but brain disease actually affects the mental well-being of a person. The person's ability to function is impaired. So that's why it's such a serious problem that we need to make people know that this problem is there and everything needs to be done to help those who already have it and those who don't have it, things that can be done to prevent even having a brain disease.
Now, apart from dementia,
Yeah.
what other diseases can you say are related with the brain?
right? Yeah, the burden of, I think I want to just talk about the burden of brain diseases. There's a report recently in 2021 by the global the global burden of diseases, and in that report, as much as 33.1 billion people in the world globally have nervous system disease, and you see that figure is very very huge. All right, and in that same 2021, about 11.1 persons died in 2021 alone from brain diseases. So very huge figure. And what about Nigeria? In Nigeria, even though we don't have clear records, but we have records about stroke, and the prevalence, the number of persons who have stroke in Nigeria is put at 1.14 per 1,000. What does that mean? It means when you have 1,000 individuals, at least one person have had a stroke. So that is huge. Imagine our population in Nigeria. So you now imagine the number of persons who have had a stroke. So there are different forms of brain diseases, and one of them that we have mentioned is dementia. And the commonest form of dementia is what we call Alzheimer's dementia. Now, but apart from dementia, stroke is also a very huge and common problem. In fact, in our facility in the Benue State University Teaching Hospital where we work, almost every day in the emergency, we have 3 or 4 new patients with stroke presenting. Adults between 18 years and 100 as the case may be. We have adult patients, almost 3 to 4 new patients every day presenting.
18 is young for me.
Yes. No, generally in adults we use 18 as a cutoff.
Okay.
So not in the pediatric population, but in the adult population.
Okay.
So we have 3 to 4 new patients presenting with stroke every day. So you can imagine in a week, just 7 days, we have almost 20 something patients presenting with a stroke. And these are the few that dare come to hospital. A huge number of them don't even present to hospital. They present at traditional homes. They treat with all kinds of things. All right. So another major neurological problem that we have in our environment is epilepsy. And epilepsy is so common. You know, when I was talking about the risk factors, one of the things I omitted is trauma. Trauma can also be a risk factor for even epilepsy. And it's a lot of concern that sometimes in our environment people are very careless. Bike riders are careless. The passengers don't even the passengers also allow the riders to ride very carelessly, and several times they fall, they hit them down, and they hit their head. People who have such accidents may likely develop a seizure or epilepsy much later. So trauma can be a cause of brain disease. Trauma can cause people to have dementia. Trauma can cause people to have epilepsy. Trauma can cause people to have even spinal cord diseases. So these are part of common diseases. What are other neurological or brain diseases in our environment? It includes headaches. And this headache we are talking about is not just the normal headache that people have when they have malaria, okay, but this is commonly what we call primary headaches, where there is no particular cause that you can pin and say, oh, this person has fever, he has malaria, he has headache, he has typhoid, he has headache, right? So headache is a common problem also in our environment. And the other thing I want to just say also about common neurological diseases is sleep disorder, where people have problem with sleep. Either the insomnia, they cannot even sleep at all. They sleep, they wake up, they are not able to go back to sleep. All these are neurological or brain diseases, and they are very, very common in our environment.
Thank you very much. Now, how can this be prevented?
Yeah.
What should people do better? How can people be helped? Those who already, have this kind of diseases or disorders living with them. We'll first look at how they can be prevented, and then secondly, we look at how those with this can be helped.
All right, thank you very much. The World Brain Day that was celebrated yesterday, I was also privileged to be part of the activity, the global activity put together by the World Federation of Neurology, and people from all parts of the world were in that meeting virtually. And the theme of the World Brain Day is brain health, prevention, and protecting the future. And so for us as neurologists, prevention is very, very cardinal. And that's one cardinal message we want to put forward to the public as well as to the policy makers, right? Prevention is key, is cardinal. That those who don't have brain diseases, there are things to do to prevent having it. And these things will include what we call health promotion, living right. Okay, I will just itemize some of them.
Please do.
Now, one of them is diet, as basic as it is. All right, it is good for people to eat healthy. It's good for people to eat well. Several studies have shown that when people eat healthy diet is balanced diets that are rich not just in protein or carbohydrates, but balanced that they also have vitamins
Okay.
and minerals.
Let's just hang up. We'll continue. We'll have a caller here.
All right.
Hello, good morning. Sorry, we lost that one. You can call in to be a part of the show. We lost that one. Call us again. The number to call will be 0813 200 9411. 0813 200 9411. Thank you. Again.
Right. So, in our environment, we have a lot of vegetables, we have a lot of fruits, but people hardly take them. All right. A study was done some years ago, a study done in Nigeria and Ghana, multiple center study on stroke. And that study showed that just people eating appropriate portion of leafy vegetable can protect against stroke. So, healthy eating is essential because vegetables, fruits have a lot of vitamins and minerals, and those are very, very essential also. Some micronutrients that helps the functioning well of the brain. So balanced diet is important.
Now, talking about eating vegetables
Yes.
and balanced diet, a lot of people are of the opinion that they prefer to take supplements because they say medically supplements are actually vegetables or herbs that have been, compounded, and they will actually serve faster, dissolve and digest and all that. What's your take about that?
Yeah, I see a lot of them, but incidentally, I don't know. Sometimes our reasoning, sometimes in this part of the world, is sometimes, let me not say upside down. All right, some things are very, very basic. They are cheap. They are available. Vegetables, fruits are available.
Yeah.
Why not take them in their natural form? Sometimes you have patients who have hypertension. The blood pressure is 220, 120. The patient is not taking his drug for hypertension, but he's taking supplement. That hypertension drug, maybe it will just cost him 5,000 to buy drugs for hypertension. He's not buying it, but he's buying supplement of 30,000, 25,000. Do you understand? So people, they in our environment, there's a lot
of misplacement
yes,
of
priority. So what I want to say, prevention starts with doing things right. Eating right food. Avoid, for those who smoke, you need to quit smoking. I think I missed smoking when I spoke earlier on as a risk factor. Alcohol need to be put aside. People who live sedentary life need to be active. So exercises, 30 minutes exercises 3 times a week has been recommended. And with age, you don't need to run, you just be brisk walking or some aerobic exercises at one spot. That may suffice. What are the other things apart from diet and exercise? Avoiding exposure to some of these toxins and chemicals that we have talked about will also be important. And more so in preventive measures, we talk about primary prevention. For instance, those who already have not had a stroke, you have hypertension. What should you do? You need to be on your drugs. You need to make sure you are monitoring. those who have diabetes, unfortunately, I have a relation, a cousin of mine. A few days ago, not in this state, I was called that he was admitted in a hospital and the blood pressure was 250, 130, and I shouted. And by the time I spoke with the wife, the young man is well to do. He has money. Money is not his problem. But he saw a doctor, and they told him he has hypertension. Instead of continuing care with the doctor, he went to one of these tradomedical places where they gave him supplements, and he was taking the supplements. And as we speak, he's still in the hospital. Why? Even as at yesterday when I spoke with them, the blood pressure is still markedly high. Probably has developed complications already. So when people have high blood pressure, I want to request that simply take your drugs. When you take your drugs, you will not likely develop complications. Now, studies have shown that the commonest risk factor for stroke all over the world is high blood pressure. So just reducing that blood pressure will prevent a stroke. A patient could have a stroke, and from stroke could have even what we call vascular dementia, could develop dementia from a stroke. A patient who have that markedly elevated blood pressure could also develop even Alzheimer's, more than the normal population. So I want to request that people should take their drugs. Someone has diabetes and you have been counseled on the need for your drugs, you've been counseled on the need for your diet, what to take, even though there are a lot of instructions currently about what to take and what not to take when people have diabetes. But when you meet specialists, you'll be told what is required of you. But if that person is taking his drugs religiously, the blood sugar will likely be controlled. And all the complications, particularly the neurological complications, will not happen.
That's such a beautiful one and so much explanation there. Now let's look at something. It might sound funny,
Yeah.
but let us know, where exactly is the brain located? We've been talking about the brain. Where exactly is the brain located?
All right, very important. Yeah, the brain is located in the head. Inside, there's a covering, the skull. The brain is located encased within the skull. All right, and the skull has several coverings around it, what we call the meninges. And inside that is now the brain matter itself. And like I said earlier on, the brain has different parts. It has the cortex, has the basal ganglia. Those are medical terminologies, never mind. It has the cerebellum, has the brainstem. Each of these parts have their roles and their function in the well-being of an individual. So brain clearly is located on
the head.
Yes.
Because I have seen people asking, don't you think, where is your mind? Are you normal? And they are touching.
All right.
Now, what if someone suffers a fall?
Yeah.
We're looking at illnesses related with the brain and diseases, disorders. What if someone suffers a fall, and let's say it is hidden? Maybe a child fell, hit the head, and all that. What are certain symptoms? What kind of things will you see? Or should you see, and then it will be a pointer that this person has suffered a fall? Because most times caregivers, parents, sometimes you're not there, you have little ones, and from what you're saying, this thing does not only involve the elderly, boils down to the young, because everybody has a brain. I think everybody has a brain.
Everybody has a brain. Without a brain, then the person is not a human being.
Good. So let's know what happened.
Okay, yeah, very important to say that fall or trauma can be trivial. Trivial means sometimes
Minute.
very minute, very mild. All right, sometimes could actually be very serious. But we talk about the trivial ones. But if someone has a fall, what part of the pointers to the seriousness of the fall would be, is there swelling? How much is that swelling?
Can the head actually swell?
Yes, you see, even though the brain is encased inside the skull, but on the head is there are muscles on the head. Okay, there are other what we call subcutaneous tissues and fats even before the skull. So if there's a trauma to the head, that head can swell. Now, it depends on the severity of that trauma. The trauma sometimes could be severe to the point where it can affect the skull, and sometimes to the point that the skull could crack or fracture. So if someone has a trauma to the head, a fall, or a trauma to the head maybe through accident, you want to check, is there swelling? All right. Is there a deepening? Sometimes the trauma could be so serious that there could be a depression on the skull, on the head. So that may tell you the severity of the trauma. Now, sometimes some trauma could also happen, and there could be bleeding from the nose. There could be, what may look like water pouring out from the ear, but for us that's not water, that's CSF. That's the fluid that cushions the brain, within the brain. So some trauma could be so serious that could pour out from the ear, and most time that is the kind of trauma that affects the base of the skull, could cause CSF to start leaking from the ear, and that is very, very serious issue that needs to be addressed. So when people have trauma, it's not enough to have a trauma or to have a fall and just say no problem, nothing happened. Now sometimes when people have trauma, you also want to know, did they lose consciousness? Right? Did they lose consciousness? Did they convulse at the point when that trauma happened? But it's important that when people have trauma, it needs to be properly evaluated by the trained physician, a trained doctor. A doctor will know what to do. Some trauma could be that serious that there are some basic tests that must be done to confirm there is no problem.
When you're calling it trauma, you're actually saying either the person fell or was hit by something.
Yes.
And we're basically concerned with the brain.
Yes.
I mean the head.
Yes.
Because that is the covering of the brain.
Yes.
So I bet you're learning something new. I am. You can follow us on all our social media platforms at benutv.ng. Please call us, call in the show. Let's know what you think about your brain's health. Let's know what you've been doing to keep your brain healthy as the show continues. The number to call will be 0813-200-9411. We lost that caller. Please don't hesitate to call again, 0813-200-9411. Dr. Iwozo, thank you very much for what you've been doing so far.
Let me just also make a clarification there.
Please do.
Now, we're trying to differentiate also the children from the adults. Yes. And I had mentioned something like trivial before.
Yes.
Now, for
that
us,
is something a fall that is not very serious.
Yeah, not significant. It doesn't look serious. No loss of consciousness, no bleeding, no swelling, and everything appears normal. In children, you may not worry so much, because the brain of the children, there's what we call neuroplasticity. The brain of the children is still growing. A lot of it's plastable. Let me use that word. But in the elderly, as people advance in age, the brain is getting smaller in volume. So the space between the skull and the brain is increasing. Any little trauma makes the brain to swing inside the skull. So a lot of problem can result. So, for instance, an elderly man of 65 might just be going to the bedroom and bang his head on the door. He shouldn't be taken lightly. Maybe he banged the head and just complained of headache and all that. Such should be properly investigated, evaluated, because that on its own can make that patient to start developing behavioral problem tomorrow, memory problem tomorrow, and by the time you are presenting, some complication could have ensued, because that banging of the head could result in a bleeding in the brain, what we call subdural hematoma. So if that happens, and sometimes by the time the patient is coming, when you didn't take note of it, weeks later, you may think the patient has had a stroke, but it may not just be a stroke. It may likely be he had subdural hematoma. This is common in elderly people. So that's why when people have such trauma, we've had people who had bike accidents, elderly people, and they presented 3 months later and their relatives said, oh, it's like he had a stroke. And by the time we do some tests, we say, oh, this is not a stroke, it's a bleeding to the brain. And that kind of bleeding to the brain, that blood has to be evacuated surgically, because without doing that, the person may not likely recover or do well. So it's important that when people have, particularly in the elderly, even trivial falls or trivial trauma to the head should be properly evaluated by a trained physician.
But now, have you had success stories relating to brain issues, and then there's been kind of solutions proffered at the at the BSc teaching hospital?
Yes. We want to say that in the last couple of years, we've had a lot of patients with different kinds of brain diseases, right? Ranging from patients with stroke to patients with Parkinson's disease, patients with dementia, patients with epilepsy, patients with sleep problems, and generally, globally, the outcome, what we call prognosis, or the success story that we expect, depends on several factors. Okay, like in stroke, part of what we advise when people have stroke is early presentation. When patients present almost immediately when they have a stroke, the outcome will be better than patients who are presenting weeks or days later. Because when they are presenting weeks or days later, so a lot of things would have been done wrongly. So now they are not just presenting only with the stroke that they had, they're also presenting with other complications that had ensued because of the delay. So what will you be battling with? You'll be battling with the stroke and also battling with the complications. So when people have neurological problem and present early, they are likely going to do well. For instance, someone has dementia also, and it was noticed at the early stage, and the relatives brings the patient to the hospital. There are drugs to be started, appropriate drugs to be given after evaluation, and we've had a lot of patients that when they presented early, you give them appropriate drugs. Some of them, they are almost near normal, that you will never know they had such problems. So early presentation is very necessary. What about people with even epilepsy? Epilepsy is a disease that the common one people know generally is the one they jerk and fall and foam. But there are other forms of epilepsy. Patients could have epilepsy and they could have abnormal behavior, talk abnormally. But generally,
let's quickly look at first aid.
Yeah.
Can there be any first aid given to a patient who has any form of brain disorders?
Yes, there are, depending on what type of brain disorder. Now, let's go back to epilepsy that we're talking about.
Yes, please.
Yes. People can develop epilepsy, can convulse rather, at anywhere. It can happen at home. For children, it could happen in the school. All right, but what are the basic things that should be done and should not be done in such persons? For when someone is convulsing, one of the things to do is to get the person to an environment, a location that is free from harm, where there are no objects, harmful objects, okay? So that even if the person is jerking, is within that environment where there are no harms. Number two, losing the clothing, okay? Number three, you put the patient on what we call the left lateral position, tilt the head to the left lateral position. What does that mean? It means this is my left. So you turn the head to the left side.
Okay.
Yes, there's a basic reason for that.
Okay.
The lungs is, there's a way the lung is anatomically. So if somebody has problem with consciousness, because somebody who is jerking, convulsing, is likely has problem with his consciousness. So saliva and all that is going down. So in the process of convulsion, the person can aspirate. It means saliva can go into the lungs and cause infection in the lungs. But when you turn the head to the left, that will not happen because the right lung is straight. So things can enter into the right lung very easily, unlike the left. So medically, we ask that they turn the head to the left side. But there are things that must not be done. We ask people, don't put spoon in the mouth of such persons.
Okay.
you may end up making the person to break the teeth. You may end up causing other harms. Right? Don't pour oil. In our environment, you see people pouring palm oil, pouring water. When you pour oil, pour water, the patient will aspirate. It may enter into the lungs and cause infection or what we call pneumonitis. So all that can complicate the patient's situation. So such patients, basically these are things that could be done, but very importantly, that many of those cases need to get to the hospital where appropriate measures can be taken. For instance, a patient with stroke, you see the patient collapsed or had a stroke, weakness on one side, unable to talk. What is very, very important is to get the patient to the hospital as quick as possible. Incidentally, in our environment, we don't have those facilities. All right, in developed countries, for like stroke, there are paramedics who are trained. You simply dial a number, they come to the house and pick the person to the hospital. Because for us in stroke, for instance, we say brain is time, brain is neuron. The earlier you get to the hospital, the better the appropriate things will be done, and the patient can survive and even walk home again.
We could actually go on and on, but I tell you, time is of the essence. And shortly before we wrap up, there's one important segment on our program, always the health tips. Please, let's have our health tips for today before we call it a wrap on the show.
Here are some health tips for your brain. Number 1, exercise regularly. Physical activity improves blood flow to the brain, boosting cognitive function and memory. Number 2, sleep well. Aim for 7 to 9 hours of sleep to help your brain clear waste and consolidate memories. Number 3, meditate. Regular meditation reduces stress, improves focus, and enhances cognitive flexibility. Number 4, eat a balanced diet. Fuel your brain with nutrient-rich foods like fruits, vegetables, whole grains, lean proteins, and healthy fats. Number 5, stay hydrated. Drink plenty of water to maintain focus, memory, and mood. Number 6, challenge yourself. Engage in mentally stimulating activities like puzzles, learning a new skill, or reading to build cognitive reserve. Number 7, manage stress. Chronic stress can harm brain health. Find healthy ways to cope, like exercise, meditation, or talking to a friend. Number 8, practice mindfulness. Focus on the present moment to improve attention, reduce mind wandering, and enhance overall well-being. Number 9, get social. Build strong relationships and stay connected with others to support cognitive health and emotional well-being. And then number 10, limit screen time. Excessive screen time can negatively impact sleep, attention, and mental health. Set boundaries and prioritize offline activities. Remember, a healthy brain is essential for overall well-being. By following these tips, you will be supporting your brain health and setting yourself up for a happy, healthy life. Stay healthy. I am Mimi Kwasi Tondo.
That's a beautiful one there.
Yeah, really?
Honestly.
Like a summary of all we have said.
Yes. So before we call it a wrap, please, what would you want my viewer to know as the most important thing about brain health?
Yeah, thank you, viewers. Just to say that you are your brain, and that brain diseases are very, very common, but they are preventable. If you have any of these risk factors that could lead to brain disease, please address it promptly. Make sure you are taking your drugs regularly, and where you need to see a specialist, please do so. And secondly, I also want to say, particularly to the policy makers, that there's need to make accessible, right, facilities for people who have brain diseases, make it accessible, make it available, because we still have a lot of problem in our environment with people accessing brain health specialists, particularly in our environment.
Thank you, Dr. Emmanuel Iwozo, for coming and talk health. It's been a beautiful time talking with you. And that
Thank
is
you.
the much time has actually permitted us to come. Yes, I bet you've enjoyed every bit of the show today. Your brain is your help. Stay healthy. Till we come your way again next week with another interesting episode of Talk Health on Benue Television. My name is Iwange Baja. Bye for now.